Welcome everyone. Thank you for joining me for today's webinar on changing the world of healthcare. My name is Elena Borelli and I am a physician associate. Just a bit about my background. I have worked in healthcare for over 20 years. I am the founder of Online Urgent Care, which is a telemedicine company where I currently practice. I also work as a medical consultant and as an associate professor of practice for PA education. I am excited to have been invited to speak in this webinar today. The topic is one of great interest to me, and I suspect to many of you as well. Today we'll be discussing the changing world of healthcare. How do we strive? This recorded webinar is intended for healthcare personnel and managers who are interested in improving the quality of the healthcare system by fostering change in the process of care and in the performance of practitioners. It should be of assistance in conceptualizing how to promote change and how to overcome barriers to positive change. So let's get started. Today, we will discuss the following topics. The first section provides an overview of how quality healthcare may be developed. The second section describes strategies for improving the performance of healthcare workers. Finally, the stages involved in behavior change and kinds of strategies that assist people in changing. After this webinar, you should be able to explain the following: how to create a work culture that empowers employees, the qualities of healthcare leaders and other professionals value in the workplace today, and highlight examples of how technology can lead to much more efficient workflows, improved safety, and enhanced ergonomics. Next, let's talk about SMART goals. SMART stands for specific, measurable, achievable, realistic, and timely. Asking questions and performing audits to form the right strategy. So change in performance or practice behavior is complex and, as many of us know, often is not easily accomplished. Asking questions is really important to see improvement. First question to ask is, what are your goals? It is important to create SMART objectives, so objectives that are specific, measurable, attainable, relevant, and time-based. The following questions can help us create these SMART objectives. So these questions are, after asking who is this organization to its patients, staff, and the community? Where do we want to go? Continue this purpose, expand our purpose, or change our purpose. So you really want to know what's your plan, where are you headed? When do we want to achieve these purposes? How do we accomplish this? Then how confident are we that we can accomplish this goal? On a scale of 1 to 10, with 1 being not at all versus 10 being very likely, we should score at least a 7. If not 7, then should reevaluate, because really if you're scoring under 7, then something doesn't seem to be on track. Once you ask the right questions, you are required to perform an audit. An audit is an assessment of specific data points to determine compliance with previously identified standards and can be performed in virtually every department within your facility. From food service to medical services, from medication inventories to patient discharges. So there are 2 types of audits. Retrospective audits, which is data pulled from past periods of time, or concurrent audits, which is data pulled from services that are provided now. In summary, use internal audits to uncover potential and current mistakes so they can be corrected. Asking the right questions will lead to finding the right answers, in which will improve how your organization operates. What are the benefits of a strategic plan? Recount the benefits of creating and implementing a strategic plan. Analyze every action within the organization. Organize them with a logical and rational eye. Evaluate them to ensure that each is an effective building block, functioning optimally, and the best option. The purpose of the plan is to address specific pieces of information that are important to patient population, communicate what services the organization offers, and learn how the services match to patients' wants and needs. To identify problems, consider conducting a patient survey to find out the overall performance of your clinic or hospital. There are many different definitions of quality in healthcare. The characteristics emphasize vary according to the perspectives of the different stakeholders involved in crafting the definition and in determining how the definition is to be used. Involving patients in the decision-making through surveys will widen your perspective and assist in strengthening your organization's strategy. The framework to establishing an empowering environment requires three main components. Quality of care has been seen as having three interrelated components. Technical care, which involves using medical knowledge and technology to maximize the benefits of care for the patient while minimizing the risks that are involved. Interpersonal care, which involves paying attention to the psychosocial aspects of care, including the patient-provider relationship, the larger social context in which care is provided, and the social circumstances of which the patient must cope. Thirdly, the organization of care, which determines its accessibility, timeliness, and the amenities provided, and efficiency. One of the earliest attempts to examine quality led to the development of a conceptual framework that divided healthcare delivery into three aspects: structure, process, and outcomes. Structure encompasses such features of the setting as the number and types of personnel, the age and type of equipment and other facilities, and aspects of organization such as committee structure. Process includes the activities involved in providing and receiving care. Process indicators of quality may involve such aspects as timeliness, continuity, and patient compliance. Outcomes of care involve the effects of healthcare on the health status of the patient and may include measures of quality of life, functional status, and patient satisfaction. The structure of the delivery system, such as its funding level, the types of mix of healthcare workers, the types of equipment available, and managerial expertise, can play a role in the quality of care delivered. The results of establishing the right organizational structure will lead to developing a more empowering employee culture. Today's and tomorrow's healthcare challenges. Let's talk more about the challenges. Around the world, every healthcare system is struggling with rising costs and uneven quality, despite the hard work of well-intentioned, well-trained clinicians. Healthcare leaders and policymakers have tried countless incremental fixes, attacking fraud, reducing errors, enforcing practice guidelines, making patients better consumers, implementing electronic medical records, but none of these have had much of an impact. Making this transformation is not a single step by an overarching strategy. We call it the value agenda. It will require restructuring how healthcare delivery is organized, measured, and reimbursed. This transformation must come from within. Only physicians and provider organizations can put in place the set of interdependent steps needed to improve value, because ultimately value is determined by how medicine is practiced. Yet every other stakeholder in the healthcare system has a role to play. It's really a team approach. Patients, health plans, employers, and suppliers can hasten the transformation, and it will benefit greatly from doing so. Everyone will benefit. Healthcare challenges will always exist, and that's why we need to train our teams to get familiar with the newest technologies and global trends. Artificial intelligence. That word has become more frequently heard in recent years. Artificial intelligence, or AI, the computing power of AI will drastically cut the time scientists spend analyzing data and testing molecular combinations as they tweak formulas and develop new ones. Already, pharmaceutical R&D labs are using AI to predict the relationship between biological mechanisms and disease symptoms. AI has the potential to improve the diagnosis and treatment plans of patients too. It's really important, though, to not forget that our main focus should be the patient. As we map out new healthcare territories, we must make sure that each route leads back to the patients. Large-scale changes driven by tech innovation are only as valuable as their impact on individual people's lives we are constantly striving to improve and extend. Let's talk about the digital future with wearable devices such as smartphones and watches and other gadgets. Wearable digital services. Data captured by these gadgets are playing an increasingly powerful role in healthcare. Free apps like Living With can help cancer patients connect with loved ones, manage appointments, and record how they're feeling. The app also syncs with fitness wearables, allowing patients to share a more complete portrait of their health with their healthcare providers. HemMobile Strive Wearable is a device for tracking activity and heart rate and logging infusions and bleeding episodes. Such detailed information will truly allow healthcare providers to deliver personalized care and also empower patients to assume a more active role in managing their own health. And that's a very important concept because you really want the patient to be invested and involved in participating in their management of their health disorders. Implementing QAPI. The level of performance of your facility and the quality of care provided to your patients are distinctions that go beyond the caliber of your equipment. It is about your people. Nevertheless, performance improvement is an ongoing cycle. Stages of performance improvement include planning work in advance so that expectations and goals can be set, monitoring progress and performance continually, developing the employee's ability to perform thorough training and work assignments, rating periodically to summarize performance, and rewarding good performance. Those are all really key steps in the performance improvement process. Using the QAPI strategy, QAPI is the coordinated application of two mutually reinforcing aspects of the quality management system: quality assurance, so QA, and performance improvement, PI. So just to summarize, QAPI stands for quality assurance and performance improvement. QAPI takes a systematic, comprehensive, and data-driven approach to maintaining and improving safety and quality in healthcare organizations. Next steps. Let's talk about improving attitudes. How do we create a work culture that empowers employees? So create a culture of caring, begin with clear expectations, provide staff with what they need to do their jobs well, so providing them with the right resources, encourage cross-training, establish an environment of open communication, always show everyone respect, perform random acts of kindness, do not reward poor performance, nurture future staff, and implement personal improvement plans. All those points are really key elements of creating a positive work culture that really empowers your employees. So, how do we improve patient care by empowering employees? Let's talk about how those are connected. By improving the staff, we can improve the provision of care. One way to improve patient care is by using the 8 principles of patient-centered care highlighted in research conducted by the Picker Institute and Harvard Medical School, which includes the following: respect for patients, values, preferences, and expressed needs, coordination and integration of care, information and education, physical comfort, emotional support and alleviations of fear and anxiety, and involvement of family and friends, continuity and transition, and access to care. All those are very key elements to helping to improve the patient care. And think about if you were a patient, those are all things that you would want to be met for you as well. You must do everything possible to provide the proper environment for your employees to thrive and improve, which in turn will enable them to provide excellent patient care. How to empower your employees: create personal performance improvement plans and encourage continuing education. You really want to support them and provide them the necessary tools. That concludes our webinar today. I hope you found it useful. Just a reminder, you can connect with the American Institute of Extended Studies on social media via LinkedIn and Facebook. Thank you so much and have a great day.